Good evening, everyone. Welcome to Meridian Clinic's Facebook Live session on what is early detection for cancer. I'm Mei Sze, the host for today and also the Youth Ambassador for the National Cancer Society of Malaysia and also a cancer survivor. Well, talking about as a cancer survivor and a cancer advocate, I cannot stress how important early detection is. Let me share with you a little bit more about my story. When we are young, I understand this feeling. We all think that we're invincible and nothing can happen to us. We don't even think of diseases. We don't even know about it. And for me, I led a relatively healthy lifestyle before I had cancer. I ate very clean. The only thing I didn't do is probably exercise. So yes, I would say I lead a really relatively healthy life. And I started having diarrhea actually once a month. I thought it was really normal. I kept losing weight when I was already pretty thin. And then my dad insisted that I see a gastroenterologist. At that point of time, I was 27. I did not even know what a gastroenterologist did. All he kept saying to me was, it's H. pylori, it's H. pylori. I didn't even know what H. pylori was. So I was like, okay, fine. To satisfy him, I went to see the gastroenterologist. The funny thing was, even the gastroenterologist told me, you do not need to go for a colonoscopy because that was what my dad was insisting on. Because I was too young, I have no genetic history of anything, and he thought that it was some bacterial infection in my tummy. And when that happened, my dad basically told him, no, she's going for the scope. And because of my dad's insistence, we found a tumor in my rectum. No, I'm not going to share with you who the doctor is. It's not his fault. It's just, I guess, the medical guidelines, because for colonoscopy, it's usually conducted on males above 50. Or if younger, it's because they have genetic history of cancer. So early detection for me helped me. If not, I don't think I'll be sitting here so happy in front of you. Early detection, in a way, helped me detect the tumor before it could spread beyond my colon walls. So in short, early detection leads to successful outcomes and increases your chance of survival when it comes to cancer. And we have an expert right next to me here today who can answer all of those questions that probably you have and I have. He is the founder and medical director of the Meridian Clinic. And he believes, he is a true believer, that beauty starts from within. I too believe that beauty starts from within because you need to be beautiful inside. You need great health to look great on the outside. And he has over 15 years of professional experience in anti-aging, nutraceutical, regenerative, restorative, functional, and even stem cell medicine. He is none other than Dr. Anshaw Lee, and he's next to me.
Thank you, Mei Sze. Thank you for your kind and lengthy introductions.
Thank you so much for having me.
Thank you. I wouldn't call myself an expert, but it's just a little bit of sharing of my past experience to the audience, and perhaps we can learn from each other.
You're definitely an expert because we're going to ask you very insightful questions and we want to hear your answers.
Oh no. Okay.
So, talking about cancer, because today's topic is early detection for cancer. So let's ask the very layman question. What is cancer?
Well, when we heard of cancers, we are so dreadful. We relate cancers to very negative sufferings, pain, hair dropping, and the eventual outcome will be penalty. So, what is cancer, right? So, cancer by and large, we define cancer when a cell grows abnormally and a cell grows without regulations. And why this unregulation happens, this is because the genes expressing the cell have some mutations. So cancer in a layman term, which means that a cell grows abnormally without the control and it becomes bigger and bigger and bigger. So once a cancer cell is big enough to cause some destruction of the organ functions, and for your case, for example, diarrhea, the change of bowel habit, and then we consult a doctor, and then from there we will get the diagnosis. Oh, we have a cancer in our body.
Yeah. So the thing was, when I was diagnosed, I could never in my life imagine that it was cancer. All I could remember him saying, the doctor saying was, blah 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 blah. We sent it for biopsy. You know, as a layperson, when I heard the term biopsy, that's when I realized it could possibly be cancer. So, like you said, you know, the tumor probably grew. I mean, from a polyp, it became a tumor, and I guess there were cancerous cells on it. That's why it's called colorectal cancer. Am I correct?
Okay, basically we are made of all the organ functions, from the brain until our intestine, until our testes, for example, or ovarian for the women, right? So all the organs, you know, we have a good genes, and good genes will have a good healthy regulation. But unfortunately, there are sometimes, you know, when this gene get wrongly expressed, or when mutation happens, by one reason or other reasons, cancer will develop.
And
So it can happen in all the organ.
yeah. So I've come to realize that because I lead a young cancer survivors group. So that aside, what made you want to promote cancer awareness? What inspired you? Because you are a master in aesthetics.
Oh, my mother told me once I dreamt to be a cardiologist when I was 7. You know, okay, never in my life, you know, I could actually imagine myself talking about cancer. Okay, being a doctor, our profession, we need to help the patients to relieve their pain, their suffering, right? Unfortunately, you know, we live in this modern society and modern technology with advancement of these all equipments. Nevertheless, we have limitations when in terms of cancer. If you are diagnosed as stage 3 cancer, we meant to say that you only have less than 5 years survival. Right. So the experience of my past when I was a houseman.
You mentioned a very heartfelt story earlier, and
Yes.
I think we should definitely share it with everyone.
Yes, okay. So when I was a houseman, I was called to attend a leukemia patient. She was at the age of 5 years old, and she was crying in pain. This patient admitted to hospital for chemotherapy at the age of 5 years old, and we have to insert a cannula, a devices to admit the medicine. And my colleague tried and attempted a few times and could not be successful. It's due to because of the vein become hardened after the chemotherapy. So I was quite sad, you know, and nothing can be done as a doctor to relieve the pain. But I tried my best, you know, and I was lucky enough to insert the cannula within one trial. And from that onwards, I vowed, you know, we should, as a doctor, we should not incur more pain when a patient already suffering. So, being a doctor, we want to help, but in terms of cancer, there are still much to be done as a doctor.
That's true. And the thing about cancer is that the hope, with all the current technology, right, we were talking about, the hope is that it will become a chronic disease, right, and not a death sentence.
Yes, of course. When we talk about cancer, we talk about the suffering negative thing,
Yeah.
right? So we try to prolong the life
Quality of life is important.
quality, yes, more than 5 years, more than 10 years, or more than 20 years.
Yes.
Right. So when we talk about cancer treatment, we want to improve the quality of patients, prevent the relapses, and also improve the quality of some other vital organs. Because once you are admitted chemotherapy or radiotherapy, some other side effect may happen.
So talking about the stages you mentioned earlier, could you share with us actually more about these stages? Like for me, I was a stage 2A colorectal cancer patient. And at that point of time when I was also diagnosed, I didn't understand the staging, like stage 2A, stage 1B, stage 2B. So maybe you can share with us the different stages and how it affects our prognosis.
So medically, we classify cancer according to early stages, which is stage 1 and stage 2. And we classify cancer as the late stages when they are stage 3 and above or stage 4.
Okay.
That's a condition we call precancerous. So we stage before the cancer happened, which is much earlier than stage 1.
Okay, so stage 0, right?
Stage 0, yeah. So when you talk about stage 1, stage 2, 100% cure is possible. But when we diagnose as stage 3, the 100% cure is next to impossible.
So you would say that stage 1 and stage 2 is early cancer, right?
Yes, by and large.
And stage 0 is precancerous.
Yes.
So if you could just tell us a little bit more, what is the difference between stage 0, which is like precancerous, versus early cancer?
Okay, because early is very subjective for how early is it we classify as early.
Yeah.
Right? So, and cancer, evolving of cancer, you need time for the cancer cell to grow.
Yeah, okay.
So the cancer may have to have abnormal activity to start with, and then this abnormal activity become more aggressive and promoting other cell to grow, right? So when we say stage 1, that means we already find evidence in some organ or certain organs that the cancer cell already can be measured macroscopically by the scan.
Okay, so I think you mentioned earlier about stage 0 and how there's a window, a time frame. So can you share more about this time frame from stage 0 to early cancer? That window of opportunity, I would think.
So the paradigm shift round is we try to intercept the window period. So what is the window period of the cancer? So for cancer to grow, first of all is the gene may have to evolve and express wrongly or become a mutation. So once this activity happens, it's due to the inflammation of the cells, right? So inflammation of cell is chronic. It takes months, years.
Yes.
So this window period is a time we can detect this activity of the inflammation and the rising trend of the tumor activities.
So when we talk about, okay, let's talk about early detection. So when we talk about early detection, you need early detection for that window period, right?
Okay. Now what we do for this early detection, we do a lot of screening, we do a lot of scans, So we try to pick up even you don't have symptoms. The main aim of this early detection is to do interception and do treatment before it becomes worse.
Okay.
So how early we could detect the cancer? There are a few ways of detection.
Yes, please share with us these few ways. I would like to know too.
Well, personally, I'm thinking cancer cell can be detected by 3 ways and 3 levels. The first level, we call it macro level. What is macro level? Macro means any size more than 1 mm and above.
Okay.
And can be detected by the scan. CT scan or MRI scan or colonoscope. Then we call it macro level and can be seen by our naked eye.
Right, okay.
But scan can only pick up any tumor of size 1 mm and above. It's not 1 cm, it's 1 mm.
That's
very, very
I'm trying to think how big is 1 mm.
Okay,
It's
this
tiny.
is 1 centimeter.
Wow, okay, so 1 mm is like,
Less than that, 1/10 of the 1 centimeter.
wow, it's tiny.
Yes. So this 1 mm and below is not possible to pick up by the scan.
Yes.
Even you have 640, the most advanced CT scan is too difficult to pick up.
Yeah.
So for that level, we use the what's called the micro level of detection.
Okay.
Anything less than 1 mm and below,
Okay.
which is not able to be seen by our naked eyes.
Okay.
So this will be a blood tumor markers and also some of the, we call it inflammation markers in our body.
Okay.
So this level of microscopic detection is very useful, whereby we can pick up abnormal cancer cell in a much earlier stages.
So this is, correct me if I'm wrong, this is early detection for early types of cancer,
Yes,
which is like the pre-cancerous stage.
precancerous stage.
Wow.
Okay, with the advancement of technology 20 years ago, we could able to break through. We call it the third level, invisible level of detection. We call it genetic testing. We can do a genomic test. We can find out all our DNA and which DNA is susceptible to cancer, which is not.
Okay.
This is much advanced in a more, we call it invisible level.
Wow. So when we talk about medical screening, I'm always advocating to a lot of people go for medical screening. So are you in a way saying that normal medical screening does not like detect early cancer?
Okay, most of my patients when they come in to see me, they say, Doc, I have a regular checkup. I did this test, I did that test, and then I'll ask them to bring and show it to me, right? So medical screening mainly have two purposes. The first one, we check our vital organ function. For example, for heart, we do ECG,
Yes.
we do echo, we do angiogram, for example. And for kidney function, we check the urea, we check the creatinine, we check the filter of the kidney. And for liver, we check the liver functions. This is the basic, we call vital organ functions. So the second aim of the medical screening will be to find out if one has cancer, or we call it an abnormal lump in the body.
So that's after the first stage, right?
No, it's together,
Okay, consecutive.
consecutively. So most of the time we place more importance in the first. That means we try to find out if our organ functions are intact, all the organ functions are functional,
Yeah.
and after that only we will sit down to see, oh look, you have any lumps in the body. Because if we do a public screening, everyone, including you and me, we may have some lump somewhere.
Yes. Okay, my parents are non-believers in medicine. Yeah. Anyways, if they are watching this, they actually don't really believe in so much. I mean, I don't think it's just my parents, but I think like in Malaysia in general, there are so many types of treatment out there. So when it comes to screening and things like that, maybe they think I go and see this sifu or sensei somewhere. That's medical screening. So in terms of your medical screening, I think we have to be specific in what Dr. Anshaw mentioned, like how it needs to go on the blood level and also like on the CT scans and things like that, right?
Yeah, because now we practice evidence-based medicine,
Yes.
right? So everything we talk about the evidence, and we talk about the incidents, we talk about preference, we talk about data.
Yeah, so I hope you guys who are watching this, please listen to Dr. Anshaw and know that it's all about evidence-based medicine, not something that does not have any evidence, and it's not researched properly, right?
Yes. So not many doctors will advocate the active screening of the cancer, to be honest.
Yeah, I think so too. So
Because you see, when we scan anyone, we can find some lump. But any lump less than 2 centimeter, they will regress. They may become smaller by itself. And not just by screening, but after screening, how can you interpret the data?
yes.
And what kind of further tests to be done? So we have to strike a balance between how aggressive to scan the patients to detect the
Yes.
cancer versus the fear, the money spent, and the effort to be done to find out if one got cancer.
So then how do we prevent early cancer? I think people want to know that. So is it the methods that you mentioned?
Okay, when we talk about early detection, we talk about the mental stage.
Okay.
First of all, we all avoid ourselves to screen ourselves. We all running away from the cancer, like it or not.
Or any diseases for that matter.
Yes,
You know?
we are complacent.
Yeah, I mean, especially if you're young, you just want to live life.
Now, sometimes it's for a believer in religion, he or she may think that this is the fate.
True.
You see, if you are fated to die tomorrow, you cannot survive after today.
So they don't care about their health. Okay. So how do we go about it if people who actually care about their health want to prevent it?
Yes, okay. So for patients, we also treat our patient very conservative, very aggressive, and for doctor as well, we have very conservative doctor, very aggressive
Yes.
doctors as well. Don't say right or wrong. It's just like, what is your preference?
Yes, okay.
And what kind of believing system you have, right? For those, we call it, they emphasize on a lot of quality of life, they believe in taking care of their own health, and they're taking more responsibility of their own health, then I would suggest them to do certain kind of tests,
Okay.
right? So the question is how early we should do the test. You say at the age of 27, you don't have any history, and then suddenly you have diarrhea, and they diagnosed with colon cancer. So at the age of 27, is it considered young to develop colon cancer or is not? Right? So according to the Malaysia 2018, the cancer statistics,
Right, the 2018 statistics.
they define cancer from the age group of 15 years old to 75.
So
It's
cancer
not from
can
20,
affect
it's
anyone.
from 15,
Yeah.
and you were 27.
Yeah.
So 27 is not classified as very early yet, according to Malaysia, the statistics of cancer,
Yeah.
right? Because cancer strikes everyone at any age and any time.
That's what I've been telling everyone. So would you say that we can prevent all forms of cancer?
It's not possible to prevent all kind of cancer, but we can prevent certain kind of cancers. Okay, basically, so what should be done to detect if we have cancers or not, right? So it's not possible to screen every year for all the organs.
No.
Because you see, for screening of the organs, for example, to detect a granuloma in the lung, you cannot pick up by the X-ray.
No. Yeah.
Okay, you may not be able to pick up like the plain CT scan. A CT scan, contrasted CT scan may able to pick up 1 to 2 millimeter of granuloma in the lung. Not until you do a CT scan, you are not sure or
Yes.
not known that you already have a tumor in your body, right? But then we could not possibly repeat CT scan every year because CT scan comes with radiation. So a treating physician must justify his act if he or she should subject this patient of him to do the test.
Okay.
So for early detection, we have to look at a few things. Number one is if you have family history, a strong family history of certain cancer, for example, breast cancer, then perhaps the focus need to be on breast
So targeted forms of screening.
from family history.
Right. Okay.
So we don't talk about genetic, we talk about family history because we only know our parents, our grandparents. We don't know our ancestor if they carry certain diseases. No one is sure they have carried certain health diseases,
Yeah.
right? So, and for cancer cell, we call it are encoded by the oncogene. It can be hidden for a few generations and get expressed in your generation.
Maybe it happened to me.
Okay, so for early detection, we will look at two things. Number one is family history, right? Breast cancer, for example, colon cancer, for example, throat cancer, for example. And second thing, we look at the prevalence of cancer in Malaysia.
Right.
So with the statistic of 2018, there are 5 cancers were having the highest record in Malaysia, namely number 1 for women, breast cancer. Number 2, colon rectal cancer.
Yeah.
Number third one will be lung cancer. The fourth one, liver cancer. And the last one is nasopharyngeal cancer.
Okay, the throat and the throat cancer, right?
Yes. So this is the prevalence of the cancer in Malaysia, right? So you may not smoke and you may practice healthy lifestyle and you don't have any environment to cause you become a secondhand smoker. But then that doesn't mean that you are free from lung cancer. Lung cancer is still rated number third highest most incident in Malaysia.
Yet no one really knows about lung cancer.
And you may not be a smoker.
Yeah.
So the aim will be focusing the pattern of the prevalence of cancer in Malaysia according to our age group, according to our races, and then we can do a little bit more tests on that cancer.
So the doctor will advise accordingly. So this is something for all of us to know. So for all of you who are interested in today's topic, you can also ask questions, and also remember, stay with us all the way till the end, because we're going to share with you how to win yourselves a little voucher from Meridian Clinic. It's worth 500 ringgit, so please stay with us all the way till the end. Now, I have personal questions for Dr. Anshaw. I mentioned earlier I lead a young cancer survivors group, and also I had cancer myself. So when it comes to realizing that cancer can hit at any age, and you've also spoken about it, and even with no genetic history, so what are the possible causes for those of us who get cancer at a younger age?
Okay, because the different cancer, they have the different characteristics and also the different pattern to manifest. So what are the factors causing cancer at younger age? So there are a few things I need to highlight. First of all is the inflammations, because for cancer cell to happen, certain mutation happen, and why this certain mutation happen, sometimes we couldn't find the answers, but we can relate some of the inflammation processes happening, and that will contribute to the expression of the cancer cell, right? The first one will be, we call diet.
Okay.
Diet, right? Okay. Yes. So now we are westernized, right? We eat burgers, we eat hams, we eat cheese, right? So for diet, the things we need to highlight will be a few things. First one will be the saturated fat in animal, and there are some linkage of the saturated fat of animal towards colon cancer, right? And second thing will be this genetic modifying food,
GMO.
right? Every day, when you go to the shopping, like for example, I go to Biggs, I will choose beautiful, the most perfect vegetables or fruits, right?
But are they genetically modified?
I'm not sure.
We are not joking.
Right. So for diet, okay, there are some food causing inflammation in our body. Okay. Namely the polysaturated fat in animal, and refined sugar, and also we call it some food they are processed.
Like canned food.
Canned food, sausages, burgers.
But everyone's stocking up on canned food though.
Yes.
Now.
Right. So other important factor will be we call it the high sugar content, right?
Okay.
And also when we consume not balanced food. We eat less vegetables, we don't eat fruits, right? The fiber can reduce the inflammation in the body. So for diet, you see, there are a few things to highlight, because for most of cancer, it happens, for example, colon cancer, the incidence is getting higher and higher and higher. It's not getting lesser.
Yeah.
Right, okay. So there's one prediction, by the time of 2040, the colon cancer will be 3 times the incidence now.
Wow. Okay.
So there are the factors of, we call it the diet, the food we eat, we cannot be 100% sure, right? But if inflammation happens in the blood level, we call microscopic level, we could have ignored and we could have not aware that is happening in our body, right? And the second one will be lifestyle. When we stress, our body also inflame. So we need to reduce inflammation. This is the things I will need to advocate, and to tell the patients, right? We have to cut down the inflammation activities, right? And there are some other things, for example, your lifestyle, stress management.
But then that's really difficult, doctor. It's like everyone is stressed if you work, even if you study, you're stressed.
Yes, I'm sitting here, I'm stressed, facing the live patients.
Yeah, all of us will be really stressed. So that is something that, okay, maybe that one we might have to try and manage it. But I guess something that we can all control is diet.
Yes, and diet, okay. And the other thing is, I need to highlight will be our sleep pattern.
Sleep, yes.
Sleep, yes. Do you know that we sleep 1/3 of our life? If you 6 hours, it's 1/3.
I sleep 8 hours.
Yes, why so?
Because I need the sleep.
Why?
Because I need to rest.
No, okay. You see, our body are very unique, right? Okay, we have many systems in our body. Okay, system A, system B, system C. And they have their own duty and they have their own biological clock. Right? For example, when you have to sleep around 10 or 11, then we have to prepare ourselves to go to sleep.
Yes.
Right? So our body, we have one organ we call pituitary glands in our mind, our brain, sorry. They will secrete melatonin. And this secretion of melatonin happens around 10 or 11, so that we can be induced to go into the deep sleep cycle. Our brainwave have 5 cycles of sleeping patterns. So we need to go to the delta wave, and whereby we are in deep sleep. So once we are in deep sleep, the system of the gastrointestinal, including the colon and rectum, they can have a good rest. Rest is very important. Rest is essential for organ function to heal, to repair, to regain its vitality. But here now, we look at the handphone, I look at the news at 12 and 1 o'clock, we look at the Netflix, look at the messages, we don't sleep, chop, we don't sleep at 1, right? And we wake up in the morning, and then we have inadequate sleep. Because sleep is very important, essential to improve our immune system. And our body function can have a balance of, we call it work and resting stage.
Okay, so the 3 main things that you would suggest, could be the causes. Maybe like for young people who have cancer is diet,
Yes.
stress management, and sleep, not sleeping enough, getting enough rest, basically.
Yes.
That could be true. I was doing my PhD. I feel like I was crazily stressed, and also the other thing was that I was living in the States, so I ate a lot of processed food. Yeah, I think that was one of the causes. I was trying to be Dr. Quack, in my mind I was like finding what could be the reason, but I had no genetic history, no family history, so it's really tough to determine the cause. Yeah.
It's not easy for doctor to answer.
No,
why we
yeah,
have cancer,
no.
but we can somehow
Try
try to
Yeah,
relate.
yeah. So that's what I did. I tried to use my analytical mind. So the question is cancer hitting people at younger ages? I think you mentioned lifestyle. So it's you would say it's definitely because of our current day and age, our lifestyle, right? That's why that's one of the causes that it could possibly be.
We have no one to blame them, we blame lifestyle.
Yes. So we have to blame ourselves, right?
Okay, because there are always some causes, this happen, it may be multi-factor, we call multifactorial.
Yeah.
Right, but we try to improve. Once we have diagnosed cancer, then we have to sit down to think what things we have done rightly and or wrongly.
Yeah.
So we could improve from them.
Okay. So then the next question is, what are the possible tests that young people should start taking?
Okay, young, is also a subjective term. So by the time of 15 to 20, we are not financially capable to do the test by ourselves. We need the help from the parents. So by the time of 25 years old, once you graduate and then you come out to work and then you work and you get some money. So there is a time within that you can start to do some tests.
Okay.
So basically the test will be blood from the blood. We do the vital organ examination and also some of the tumor markers. And then by the age of 30 to 35, perhaps you can do a little bit of a more detailed investigation. For example, the ultrasound scan, a CT scan, and for ladies, mammography is important after 35 years old, or maybe a bit much earlier. We may consider if you have a strong family history of the breast cancer. Then Pap smear also very important.
I think a lot of people miss out on Pap smear because there's a stigma towards it.
And then also, and many people we have forgotten that virus do contribute to some cancer. For example, hepatitis can cause
Yes.
liver cancer,
Liver.
and HPV can cause cervical cancer.
So I mean this is a bit out of topic, but when we talk about cervical cancer, there is also the stigma surrounding going for tests like Pap smears to determine like HPVs because it's related to cervical cancer, right?
Yes, yes.
So that is something that, is there any possibility that, what do you think can help like reduce the stigma associated with these types of cancers?
I think I would say that the mental stage, for example, because you see, now if you want to detect early, you must go forward to do the test. You sit at home, you cannot find anything,
Yeah, that's true. I agree.
right? So, and I think the mental state will be awareness of the cancer, and we confront and we go to uncover. You see, they are not silent killer. They have been around, but we just ignore, or we could not aware.
That's why we're doing this Facebook Live now, and more importantly, I think I want you guys to find out. I mean, like, if you feel this is beneficial, you can share this with your friends and family. We want them to know. We want them to be aware. I think awareness is a huge stage, like what Dr. Anshaw mentioned, the mental stage of being prepared to understand more. I think these are important. So please share this Facebook Live if you feel that can benefit someone, right, Dr. Anshaw?
Thank you.
So, if let's say we detect in a way we detect a person is precancerous, what should they start watching out for if they are precancerous? If it's already detected, they are basically in stage 0.
Okay, precancerous is the term we use it when we find something abnormal, okay, but before they become a cancer, right? Usually by Pap smear, the swab, vaginal swab, you see. So from the histopathological report, we see these cells are abnormal. So we term them precancerous. So doctor will be more alert and they will caution the patients to do more regular tests and to try to do a certain kind of treatment to get rid of the precancerous condition. Yes.
So the most important is if we could even detect it at an early stage, in a way we could solve the problem.
Yes, of course. When you detect early cancer, the cancer is confined, and pre-cancer condition is even much better in terms of prognosis. It haven't happened, but you already get rid of the cancer cells, for example, right?
Yeah.
So I think that is very important, and the awareness of the cancer, and then we confront, and then we try to face it. We try to do enough tests to make sure that we are free from certain type of cancers.
That's true. I mean, now, especially if you have genetic history or family history, like what Dr. Anshaw mentioned, I think you definitely need to take charge and be mentally prepared to go for these tests. So I actually have a last question for you. I always believe in early detection and I advocate it very strongly. But sometimes things like colorectal cancer, like for me, I've considered myself already detected it at such an early stage already. But a lot of people that are younger are not advised to do colonoscopy. So what are the alternative detection methods?
Okay, for cancer of colon or rectum, okay, colonoscopy is not the only method to detect.
Okay.
Right. So and there are few other tests you can do and to avoid yourself getting the colon cancer. Okay. The first one will be, we call it a fecal occult blood test. Have you heard of fecal occult blood test?
Yes, but I mean, I don't know about the fecal occult, but I know about the fecal test, and I did that, and it came back negative
How many times you did?
once.
Once, alright.
But that was 6 months before I found out that I had cancer. So maybe that time it hasn't spread. I don't know.
Okay, and you see, in a country like Australia, they have sent a free sample kit to all of their citizens above 50 years old. And they will contain an envelope, a return envelope with stamp and with a bottle, right? And then you can just pass some soap and then you put on it and you send back. So in Australia, they send and they call it a routine medical screening for all their citizens. But unfortunately in Malaysia, we government hospital and private hospital, we don't ask our patient to do this test because it's very messy. How to collect the fecal material in a bottle is damn messy.
Yes.
It's very messy.
Unpleasant.
Yes, right. So the government hospital they don't actually promote, neither do the private hospital. So they will ask you to do the colonoscopy, which is much more expensive. But colonoscopy is already we call it a macro level of screening.
Yeah.
Right. So the data have actually shown if you have performed this, we call it fecal occult blood, twice a year, you can reduce the incidence of the colon cancer by 30%.
Wow. So at least that's very good information for a lot of you out there. There are alternative testing methods.
Yeah. So the other one, it will be, we call it tumor markers, right? Tumor marker of CEA and also 72.4. We can use that as the information to detect if cancer cells are growing in our body. There are two more other these tumor marker, which is CA125. We use it to detect ovarian cancer. It can be useful. And also CA199, when we use it to detect our pancreas cancer.
Pancreatic.
So we can use this tumor marker as guideline. If the trend is increasing, then we say, oh, look, something abnormal activity is happening.
Yes.
So we try to intercept.
And it's not as invasive because it's just a blood draw.
Yes, exactly.
Yeah, that's so much better. Every time I go for my colonoscopy, it really it's not a pleasant experience.
Yes, because it's very
invasive.
You're
sedated.
Yeah. So it's not a pleasant
No.
experience.
Yes.
And then how frequent you should one should do colonoscopy?
I think for me, I mean for everyone else or
Yes.
me?
Yeah.
For me, I originally was once every 6 months. Then after now it's once a year.
Yeah. But you see, cancer cell happen from we call invisible level to microscopic level to macroscopic level. It depends how you can intercept.
So I mean, I really like the other alternative methods you mentioned, like the CEA based on blood draws.
Yes.
That's a great method.
Yes, it is not perfect, but then somehow it can serve as a function and deterrent to prevent cancer cells from growing, and we can detect much earlier.
That's great. Thanks a lot, Dr. Anshaw, for sharing that information. So I believe we have a question from the audience. So the question is, how reliable are blood cancer marker tests?
Okay, the tumor markers we call it, we use it as guideline to detect cancers, right? So when we talk about reliability, we talk about the specifically and how accurate the test will be, right? So a negative test doesn't mean that you are free from cancer, but a positive test, it warrants a more thorough details and further investigation, and you should take it more seriously. So we can get some information of the trend of the tumor marker. It's not the reading of the tumor marker, because someone may be born with high tumor marker, and yet he or she never have any symptom, never have any cancer in his or her life. But the trend of the upward increasing of the tumor marker, from there we are a little bit cautious, right? So for your questions, a tumor marker may not be perfect in detecting cancer, but it's very useful tool we can use and at a very cheaper cost to find out if we have any cancer already happening in our body.
Especially those specific cancer markers you mentioned, right? The CA77.
Yes.
Yeah.
Right. For example, okay, you may have a high CA199, right? And CA199, we refer this organ will be pancreas. But then surrounding the pancreas, you have neighbors of liver, gallbladder, the duct, you see. So, and in certain kind of patients, for example, a patient of mine, she have a high CA199. We do a scanning of this pancreas, nothing can be found. And we screen the liver, is clean. But then, to our surprise, we found actually she has some ovarian tumors. So from this investigation, it leads us to find out why it's happening if one have high tumor marker. By translation, when you have high tumor marker, it means the inflammation is happening.
So it's a warning sign already.
Yes. I do have another patient, you see, traveling from Mua, right? She came to see me to fix her physically, become more pretty, and also she want to be more feminine, right? So, she want me to, basically it's a zoo treatment to make her pretty inside out, right? And for me, always I try to, advise her to do a medical screening, blood test, to start with, you can see, because you have a pigment in your face, it may be reflecting your liver is not good, inflammation happening in your liver. And after the test, we found that CA125 is quite high. And then CA125 is ovarian cancer, and it can be also lung cancer, and it can be other intestinal cancer as well. But when we talk about CA125, we're referring to ovarian predominantly.
Yeah.
Alright, okay. And I asked her, look, are you taking any supplement or anything in your lifestyle that can promote the CA125 of in a higher level than the normal? Then she said, Doc, you are a fortune teller, I'm consuming some of the, we call it a female vitality supplement from the shelf. So I said, look, okay, because when tumor markers are higher than the norm, it's not good. I say, nothing's happening. We try to find out the causes. We may not be able to find the causes, but most of the time, there are some causes. So I advise her not to consume supplement for the next month to 3 months, and we repeat the test. But after a month, the CA125 dropped significantly to the normal stage. So by simple of withdrawing the blood, she actually have saved her own life. You see, we don't know if consuming of the supplement, the tumor in marker will become higher and cause ovarian cancer.
That's true. This is a very good method and tool to detection. I even tried it. I even did a blood draw with Dr. Anshaw as well. So, thank you so much for your question, and also thank you so much, Dr. Anshaw, for answering all of my questions. And I do hope that all of you benefited from Dr. Anshaw's answers, and that, like I said, please share this live session. And now I'm going to tell you how to win yourselves a 500 Ringgit voucher for a comprehensive blood analysis and also a tumor marker analysis. So how you can win it is tell us why you or your loved one should get this report or analysis done. And you can, if it's your loved one, you can tag your loved one. Remember that the contest actually starts today all the way till 11th of October, and for this live stream we will be reposting it tomorrow on the Meridian Clinic Facebook page. So please share with us why you should win this 500 Ringgit voucher for comprehensive blood analysis and also tumor markers. Alright, you can tag your loved one if you would like to win for your loved one. Okay guys, more importantly, please stay safe. We hope that this has benefited you, and this is Pink October, so Dr. Anshaw did mention a little bit about breast cancer, which is perfect. We hope that all of you will understand more about early detection and of cancer awareness. Thank you so much once again for tuning in tonight, and we hope to see all of you soon at Meridian Clinic, and good luck to all of you for joining the contest. Thank you.
Thank you, Ms.
Thank you,
Thank
Dr.
you.
Anshaw.
Bye-bye.
Bye.